The topic for today is an interesting one. We're going to study about APH. APH is basically any sort of bleeding into the genital tract, into or from the genital tract after the period of viability. Okay. Any bleeding from or into the genital tract after the period of viability. We're going to start with two scenarios first. What? That's on examination. OE mano on examination. মানে breach, presenting part is breach. What is this? What type of antepartum hemorrhage? You have a basic idea, right? Antipartum hemorrhage is basically of two types. We know that placenta previa and abruptio placentae. This much we know, right? What is this? Why? Achha. The next one, huh? Read. Difference কি পেলাম আমরা আগের কেস থেকে? Where is the pointer? Yeah. This is no associated pain abdomen, okay? Whereas this one has diffuse pain abdomen. Next. She had severe headache for the last 3 days. On examination, কি কি ডিফারেন্স পেলাম আমরা দুটো কেসের মধ্যে? Fetal parts not palpable, fetal heart rate is not audible. This one has a very high BP with symptoms of PIH, the other one had a normal BP. এগুলোই পেয়েছি আমরা. This one is an abruptio placentae. We're going to come to the different clinical features. So, যেটা বললাম, antepartum hemorrhage is any bleeding into the vaginal tract or from the genital tract after the period of viability. The period of viability is 28 weeks and its incidence is almost 5 in 100 pregnancies. Causes. The important causes, as we said, is placenta previa and abruptio placentae. This one you need to know. The others are accessory causes. There may be cervical erosion, CS cervix, there may be CIN, some kind of cervical varicosities. These three. You know, these are placental abnormalities. You have to read this in placenta topic. Circumvallate placenta, battledore placenta, and abelamentous insertion of the cord. Anybody can tell me what is vasa previa? What is vasa previa? Has anybody heard the term vasa previa? No? Achha. When vasa previa is a condition, it also causes bleeding. ঠিক আছে, এরকম normal APH এর মতো bleeding হবে. This is when the bleeding comes from the fetus. The bleeding is coming directly from the fetal blood vessels. Normally আমাদের কি হয়, fetal umbilicus থেকে blood vessel traverse করে directly to the placenta. এখানে কি umbilical veins are attached to the membrane, not to the placenta, and they traverse directly. কোনো insulation নেই, umbilical vessels এর উপরে কোনো insulation নেই, directly গিয়ে placenta মিলছে by crossing the internal os. So the bleeding comes from the umbilical vessels of the baby. So this is placenta previa. Placenta previa is basically when the placenta is localized into the lower uterine segment. Normally, placenta is usually situated in the upper segment, more commonly in the posterior fundal region of the uterus. But here the placenta is located in the lower uterine segment. What is the lower uterine segment? The uterus is divided into two parts. The upper segment comprises almost 4/5 of the uterus, whereas the lower segment is 1/5. It is divided between the anatomical and the histological os. Isthmus বলে একটা জায়গা হয় ইউট্রাসের, সেই isthmusের থেকে বাকি পার্টটা towards the cervix is basically the lower uterine segment. It is differentiated by the loose attachment of the peritoneal fold of the bladder. This loose attachment of the serosa. So when the placenta is attached to the lower uterine segment, it is called a placenta previa. During development, all placentas are attached on the lower segment. When the baby is developing, the first trimester, early second trimester, all placentas are located on the lower uterine segment only. Then we have something called trophotropism. You have a phenomenon known as trophotropism, where the placenta migrates to the more vascular upper segment. This is called as the failure to migrate to the upper segment is basically a placenta previa. The risk factor for it is, the most important risk factor for a placenta previa is a previous placenta previa. যেই পেশেন্টের একবার placenta previa হয়েছে, that patient will again have placenta previa. Previous cesarean sections, any kind of fetal malpresentations, smoking, alcohol intake, etc. This one you need to know. There are 4 types of placenta previa, grade 1 to 4. Look at this picture. 4 is the most severe type, the central placenta previa, that the placenta is attached directly on the internal os. In grade 3, gradually migrating away from the os, but within 2 centimeters of the os. This is a very old short note, পুরোনো দিনে আসতো, এখন আর আসে না, but is a dangerous placenta previa. So this is a type 2 posterior placenta previa. How does a placenta previa patient present to you? Read. Somebody read. Clinical presentation. How does it present to you?
Vaginal bleeding, sudden onset, profuse, painless, recurrent, and causeless.
Right. Each point has a very important meaning. A placenta previa bleeding will be. Is it okay? A placenta previa bleeding will be sudden onset, causeless, recurrent, and painless. All are very important points. Remember the case scenario number 1. There was no pain, there was no cause to the bleeding, and it will be recurrent. It usually presents with a warning hemorrhage. Patient directly profuse bleed করবে না, একটা warning, একটা দুটো warning hemorrhage দেবে. Around 32 weeks, 34 weeks there will be a warning hemorrhage. অল্প অল্প bleeding হবে, but it will be causeless. There will be no abdominal trauma, there is no PIH, there is no history of any kind of genital trauma. This patient will present you sudden onset, রাত্রিবেলা শুয়ে আছে, একদম ক্লাসিক্যাল হিস্ট্রি আসে, পেশেন্ট সকালবেলা ঘুম থেকে উঠে দেখছে বেডশিট পুরো সয়েলড হয়ে গেছে ব্লাডে, there was no pain, she did not wake up with the bleeding, just ঘুম থেকে উঠে দেখছে পুরো বেড ভর্তি ব্লাড. This is the classical feature of a placenta previa. On examination, you will find pallor. The patient may be in shock. On examining the abdomen, the height of the uterus will be same as the period of gestation. There is no increase or decrease in the height. Usually there is a malpresentation. কি হয়, প্লাসেন্টাটা লোয়ার সেগমেন্টে অ্যাটাচড আছে, তো লোয়ার সেগমেন্টে ফিটাল প্রেজেন্টিং পার্ট ঢুকতে পারছে না. The presenting part is usually in the upper segment, floating থাকবে. আর ফ্লোটিং থাকলে সবচেয়ে ইজি কি হচ্ছে, ব্রিজ হয়ে যাচ্ছে. There is malpresentations and malpositions of the presenting part. This one, stalwart this sign. যখনই আমরা fetal presenting পার্টটাকে ভিতরে পুশ করার চেষ্টা করছি into the lower segment, it is compressing on the placenta. As soon as it compressing on the placenta, it is baby is not getting any blood flow কমে যাচ্ছে বাচ্চার, সেই blood flow কমার জন্য it is having a reduction in the fetal heart rate, decrease in the fetal heart rate. This is known as a stalwart this sign. আবার ঠিক হয়ে যাচ্ছে বাচ্চাটাকে ছেড়ে দিলে. Investigation of choice is a USG. Whenever a patient comes to the clinic or the OPD or the emergency with any kind of antepartum hemorrhage, you have to go for an ultrasound. That is investigation of choice. The ultrasound will show a placenta on the lower segment. Ultrasound class হয়েছে নিশ্চয়ই একটা কোনো, you've seen plates of ultrasound, right? না HSG তো আমি নিয়েছিলাম, USG SGD তে হয়েছে. একটু carefully দেখ, this is the bladder, this black part uterus B is the bladder, this one is the cervix uterus C, just opore hocche this big mass is the placenta. You'll find a placenta which is just adherent on the cervix. Management, keep this one, this is more important. That a question এসেছিল না কনজারভেট the সিনিয়রদের কোয়েশ্চেন পেপার দেখেছিলি কোয়েশ্চেন পেপার একটা সেমিস্টার ইয়ে হয়েছিল না কদিন আগে? You saw the question papers, right? Conservative management for placenta previa. This is basically whenever a placenta previa bleeds, but she is not term yet, she is before 37 weeks, you have to go for a conservative management, which is known as a McAfee and Johnson regimen. Sorry. So what we do is we admit this patient. You admit the patient and you observe the patient. Don't do anything else. পেশেন্টটাকে আমরা রেগুলার মনিটরিং করব, রেগুলার একটা হিমোগ্লোবিন সিবিসি পাঠাবো, উইল চেক দ্য প্যাডস, ভ্যাজাইনাল প্যাডস ফর এনি ফার্দার ব্লিডিং, উইল মনিটর দ্য fetal heart rate, and we will give steroids for the lung maturity of the fetus. We want the baby to reach 37 weeks. Whenever she reaches 37 weeks, we are going to deliver the patient. We are going to deliver her by a cesarean section. Most commonly by cesarean section. A placenta previa, you will never go for normal deliveries, vaginal deliveries. We'll go for cesarean section, all placenta previas. This is the part which is common for all APH. Whenever you have to write management of APH, you have to mention that you call for help. Just like PPH, you call for help. APH cannot be managed on your own. You give hospitalization, do 2 wide-bore cannulas on both hands for IV fluids, ABC of management, airway, breathing and circulation, blood requisitions, and you go for immediate delivery. Placenta previa যদি প্রচুর bleed করে, she will land into shock, DIC, renal failure, multiple blood transfusions. This one is important for you, morbidly adherent placenta. You're going to read about this is placenta accreta syndromes. The next point is the abruptio placentae. What is abruption? Premature separation of a normally located placenta. Normally, when a placenta is not in the lower segment, the placenta is in the upper uterine segment, but it is separated before delivery. When is the normal time of separation of a placenta? More specific? When is the normal time of separation? Placenta কখন বেরোয়? Third stage of labor. Simple. During the third stage of labor, anytime the placenta is separated before that is known as an abruptio placentae or an accidental hemorrhage. Achha. This will have particular causes. Abruption is never a causeless phenomenon. It will have causes. Most common cause হচ্ছে PIH, pregnancy induced hypertension, and the second most common cause হচ্ছে any kind of genital trauma. This patient will come to you with a history of trauma or PIH. আরো কতগুলো রিস্ক ফ্যাক্টর আছে, থ্রম্বোফিলিয়াস, প্রোটিন সি, প্রোটিনেস ডেফিসিয়েন্সি, স্মোকিং, snake bite. Snake bite is another very important phenomenon to village area. There are two kinds of abruption. This you need to remember. This chart will be important for you in examination. You have two kinds of abruptio placentae. One is a concealed type, the other one is a revealed type. একটাতে bleeding হবে, একটাতে bleeding হবে না. Which is more dangerous? কোনটা বেশি dangerous? কেন? In the concealed kind of variety, the patient does not present to the hospital before she is in shock. This patient comes to you in absolute shock. Kono pulse পাওয়া যাবে না, কোনো BP পাওয়া যাবে না. She has been bleeding throughout her for the last 1 day maybe. It was all collected in the uterus height becomes more than the period of gestation, all the blood is collected behind the placenta. So shock is the main feature, whereas in the reveal type, bleeding is the main feature. এই পার্টটা দেখে নে, this reveal type usually has a বাচ্চাটা বেঁচে থাকে, but in concealed type বাচ্চাটা মরে যায়, continuously bleeding হচ্ছে, প্লাসেন্টার পিছনে blood জমছে, the baby is not getting any nutrition, the baby is dying inside the uterus. You have a dead baby, no fetal heart rate, tense tender abdomen without any and on palpation the fetal parts are not palpable at all. Okay, this one is also important. In concealed variety there is alteration in the clotting profile. Eto bleeding হচ্ছে, the patient lands into DIC. What is DIC? Intravascular coagulation, disseminated intravascular coagulation. There is so much coagulation happening within the uterus that all the clotting factors are exhausted. The patient lands into bleeding everywhere else. Sorry. Okay. This is a more severe variety. We are causing hemorrhagic shock, renal failure. You have PPH. Any APH complication है PPH होते ही पारे, जेकोन APH patient. Management of abruptio placentae is again same. You admit this patient, you give her fluids, you do blood requisition, 2 bottles of blood for every patient, 2 wide bore IV cannulas. Delivery. How you deliver this patient? Abruptio can be managed by a vaginal delivery. You can go for artificial rupture of membranes with syntocinon induction. Okay. If this abruption is also bleeding profusely, massive যদি bleeding হয়, you have to go for cesarean section, otherwise you attempt vaginal delivery. This is again a short note, এটাও এসেছিল এবার ক্লাসে, class বলছি, সেমেস্টারে এসেছিল, puviliar uterus. This is a complication of an abruptio placentae where the যেই ব্লাডটা প্লাসেন্টার পিছনে বেরোচ্ছিল, the blood is getting out of the uterus, it is seeping into the muscles of the uterus, making it this darkish brown bluish texture. This blood can seep into the peritoneum of outside the uterus. It can present with hemoperitoneum. The patient is usually in shock. দেখে প্রচন্ড খারাপ লাগছে, but this does not require a hysterectomy. The uterus contracts on its own, deliver করে দেওয়ার পরে uterus contract করবে, PPH ও কম হবে, and this uterus becomes normal after 2 to 3 weeks. Acha. The third kind of APH, which is common nowadays, যেটা এখানে প্রেজেন্টেশনে বানানো নেই, is known as a placenta accreta spectrum. Anybody has heard of placenta accreta? Placenta accreta? No? We have a spectrum of disorders which is known as a morbidly adherent placenta. Normally কি হয়, বাচ্চা বেরোচ্ছে, প্লাসেন্টা ইমিডিয়েটলি 10 মিনিটের মধ্যে সেপারেট হচ্ছে, প্লাসেন্টা সেপারেট হয়ে বাইরে বেরিয়ে আসছে. This is normal phenomena. But in some cases the placenta is adherent into the uterus. Uterusের endometrium ভেদ করে myometrium, even perimetrium অবধি প্লাসেন্টা ঢুকে যাচ্ছে. This phenomena is known as a morbidly adherent placenta. We have 3 kinds of adherent placenta: placenta accreta, placenta increta, and placenta percreta. নামগুলো শুনেছে কোনোদিন কেউ? Accreta is when you have less than 50% invasion into the myometrium. The placenta is embedded into the myometrium but less than 50% of depth. Increta is where the placenta is embedded more than 50% of the depth. And percreta হচ্ছে entire myometrium traverse করে যাচ্ছে, it can land into the serosa. The placenta may be present inside the bladder, the placenta may be present as far away as the skin. এতদূর ঢুকে আসতে পারে, ঠিক আছে? This is known as a placenta percreta. It's a very, very bad syndrome. যতগুলো cesarean section বাড়ছে, with increasing rise of cesarean sections, the incidence of morbidly adherent placenta is also increasing. Management is a classical cesarean section and hysterectomy. What is a classical cesarean section? আমরা আজকাল কি সিজারিয়ান সেকশন করি? পুরো নামটা কি? এলইউসিএস এর ফুল ফর্ম লোয়ার ইউট্রাইন সেগমেন্ট সিজারিয়ান সেকশন। বাট আজ থেকে 50 বছর আগে there was no concept of a lower uterine segment. People used to know uterus incision দেবো বাচ্চা বের করবো। So we had something called a classical cesarean section. মানে হচ্ছে we don't look for the lower segment, we just open the abdomen, we give a longitudinal incision on the uterus upper segment. ঠিক আছে? This is what we do in placenta accreta syndromes and sometimes in placenta previa also. We don't go for the lower segment transverse incision, we give a longitudinal incision on the uterus. This is done in placenta accreta jate amra placenta take na dhori. We cannot touch the placenta in case of placenta accreta. Many obstetricians has faced this. There was an undiagnosed morbidly adherent placenta, normal cesarean section kora hoyeche, kore placenta jei dhoreche, the patient starts bleeding massively. Massive bolte within the next 30 seconds she is going to bleed entire 5 liters of her blood. Atota bleeding hoy. In a morbidly adherent placenta, even if you touch the placenta, a millimeter of separation of placenta, she is going to bleed like hell. So entire OT field, OT table ঘুরে যাবে, এত blood বেরোবে. In 30 seconds, she is going to die in the table. So the management will always be you deliver the baby by a classical section, upper uterine segment cesarean section, and do not touch the placenta. Either you leave the placenta in situ as it is, or you go for a hysterectomy along with the placenta. Okay? Tranexamic, nothing is going to work. I'm telling you something. In 30 seconds, you're going to standing in ankle deep blood in the OT floor. That much she bleeds in placenta accreta. So all cesarean sections, before you do cesarean sections for any kind of placenta previa or placenta lower segment placenta, you have to go for an MRI or a 3D ultrasound to rule out placenta accreta syndromes. Eta kintu short note. Placenta accreta comes as a short note. We're basically done for the class. Any questions? Achha, I'll have questions for you. If you don't have questions, I'll have questions for you. Wait. I'll take 5 more minutes, not much. Somebody tell me, if a patient comes to the bleeding with bleeding in OR at 34 weeks, we have this. Sorry, since we have done for the class, you're going to tell me how to manage this patient. Diagnosis and management. আমরা দুটো কেস সিনারিও ডায়াগনোসিস করব এন্ড ম্যানেজমেন্ট করব, একটু মনে রাখার জন্য। দিস ইজ গোইং টু কাম ইন ইউর এক্সামিনেশনস, ভেরি সিমিলার কোয়েশ্চেন্স। এগুলো শর্ট নোট আসবে, এগুলো লং কোয়েশ্চেন আসবে না, এগুলো ইভেন প্র্যাকটিক্যালে স্লাইড থাকবে, প্র্যাকটিক্যালে পেশেন্টও থাকবে বা কার্ড থাকবে। সামবডি ভলান্টিয়ার ফর ডায়াগনোসিস এন্ড ম্যানেজমেন্ট।
স্যার মানে ফার্স্টে যখন দেখিয়েছিলেন তখন আমার মনে হচ্ছিল প্লাজেন্টা প্রিভিয়াই, মানে এখনো তো ওটাই মনে হচ্ছে স্যার। মানে আলাদা করে কিছু মানে যেটা আপনি আগে পড়েছেন সেই ডেটাগুলো আমার এক্সাক্ট এখনই তো মনে পড়ছে না, কিন্তু এটা দেখে প্লাজেন্টা প্রিভিয়াই আমার লাগছিল।
Something very important to know is airway মানে কিন্তু intubation না। When we say ABC of management of any kind of shock, the A means airway, it does not mean intubation. Airway mane you have to check and maintain the airway. If she's breathing on her own, why would you put an intubating tube? Right? You check and manage the airway, that's it. Next, airway pore কিছু করবি তার জন্য আর পেশেন্ট যে জেগে আছে নিজে নিজে ব্রিদিং নেবে। সার্কুলেশন, মেইন সার্কুলেশন। What do you do for circulation? What do you do for circulation? You make 2 cannulas on both her limbs, 2 wide bore cannulas on her arms, and you start her on IV fluids. Right? IV fluids is the main maintenance. Patient bleed করছে, she is losing fluids, you give her IV fluids. You take blood for ball. তারপর একটা বল,
blood transfusion.
blood requisition and blood transfusion, right? Everybody agrees for blood requisition and blood transfusion. Next one. And ball. What is it?
তুই বল না না
স্যার তারপর দেখতে হবে পেশেন্টটা মানে যেহেতু স্টেবল আছে, তো স্টেবল থাকার জন্য আমি জনসন ম্যাকএফি রেজিমের দিকে যাব।
What is the period of gestation of the patient? কত উইকসে আছে? 32. If she is stable, I am not going to deliver her at this point. I am going to go for a conservative management, right? বিপি ভালো আছে, ট্যাকিকার্ডিয়া নেই, খুব বেশি প্যালার নেই, পেশেন্ট শকে নেই, ফিটাল হার্ট রেট ভালো আছে, ইউট্রাস নন টেন্ডার আছে, হিস্ট্রি অফ ব্লিডিং আছে, I can go for a conservative management, the McAfee and Johnson regimen. কি করা হয় McAfee Johnson regimen? বল।
সামনে থেকে দেখা যাবে। সামনে তো in a hospital setting with 24 hours facility for C-section or rarely at home if within 30 minutes from hospital.
What does this mean? You admit this patient in a hospital which has a 24 hours facility. Approach or needs again, you can go for emergency medical or sometimes a patient may get parasitic to monitor for a day. Next point.
Bed rest with close proximity to a bathroom facility.
হসপিটালে এমন একটা বেডে রাখতে হবে যার সামনে বাথরুম আছে, পেশেন্ট যাতে বেশি হাঁটাচলা দৌড়াদৌড়ি না করে।
Daily monitoring of vitals and fetal heart sound. And regular inspection of vaginal pads. USG every 2 to 3 weeks. Expected management to be stopped when gestational age reaches 37 weeks.
Maturity আগে এই কন্ডিশনে আমাদের ডেলিভার করতে হতে পারে, even if it is not mature. If the mother goes into shock, severe bleeding শুরু হলে mother goes into shock and it's over. If the fetal heart rate drops, the fetus is in distress and deliver. If the baby dies in utero and deliver, or if the patient goes into labor. ঠিক আছে, চলো। Mode of delivery কি বলেছিলাম? Caesarean section. Always say caesarean section. Don't go for anything else in placenta previa. তাহলে কি দাঁড়ালো? Placenta previa is the case. We're going to admit her. We're going to do conservative McAfee and Johnson regimen for this patient, and we're going to deliver her by caesarean section at 37 weeks. ওকে, দিস ইজ দ্য সেকেন্ড কেস। এটা কে বলবে? Should I go that side? মেজরিটি বলে দিয়েছে, কিছু করার নেই। রিড পর 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 wait. পর পর।
18-year-old 18-year-old G1P O দেখা যাচ্ছে স্যার G1PO primary gravida at 32 weeks of gestation, present to ER with history of severe pain abdomen for last 4 hours with loss of consciousness. She had severe headache for last 3 days with blurring of vision. Valor BP 175 110.
শোনা যাচ্ছে না? The patient is at 32 weeks of gestation, a primary gravida patient. She has come to you with a history of severe pain abdomen for the last 4 hours, active bleeding PV. Her BP is 170 by 110. তার মানে সিভিয়ার প্রেক্লাম্পসিয়া আছে, রাইট? সিভিয়ার প্রেক্লাম্পসিয়া, পালস রেট বেশি আছে, মানে শি ইজ ইন ট্যাকিকার্ডিয়া রাইট নাও। প্যালার প্লাস প্লাস, দুটো প্লাস কটা দিয়েছে? দুটো না তিনটে? দুটো প্লাস। মডারেটলি সিভিয়ার অ্যানিমিয়া আছে পেশেন্ট। On examination, the uterus is tense and tender. Fetal heart rate is not audible. Fetal parts are not palpable. Right. What is your diagnosis? What is your diagnosis? Hold. What is your diagnosis of this case?
No fetal heart sound.
No fetal heart.
IUFD.
IUFD is fine, but what is the diagnosis in this case? What topic are we talking about? Shift to the next one. What is the diagnosis? No? Sit. You don't have to stand. This is not an examination.
Sir, placenta previa.
Sir, something C uterus. It was. Sir, something C from C uterus. There was.
What kind of APH is this? What kind of APH is this?
Abruptio Placentae.
Thank you.
What is the consensus? Will you wait or will you deliver? কত সপ্তাহ আছে? What was the diagnosis? Abruptio Placentae. Abruptio Placentae টাচ করতে বারণ করেছিলাম, তাই প্লাসেন্টা প্রিভিয়াতে বারণ করেছিলাম। অ্যাব্রাপশনে কি আছে? কোথায় প্লাসেন্টা লোকেটেড আছে? Where is the placenta located? Normally in the upper uterine segment. There is no contraindication touching or removing the placenta, no? But that's going to come later. The patient is again at 32 weeks. আগের পেশেন্টটাও 32 সপ্তাহ ছিল, কি করেছিলাম? কনজারভেটিভ করেছিলাম। এই পেশেন্টটা কত সপ্তাহে আছে? 30. Wait or deliver? Why? What is the difference? আগেরটাতে আমরা ডেলিভারি বললাম না কেন, এটাতে কেন বলছি? The delivery is right. You have to deliver. Yes, very good. One point is the patient is in shock. She is unconscious. The patient is in shock, number one. That means she has lost a lot of blood. You cannot wait for the blood to stop, number one. Number two, do you see it? Fetal heart rate is not audible. Mane, the baby has already died. What is the point of waiting? Hai na? যখন বাচ্চাই মরে গেছে, why do you wait? So you have to stabilize this patient. Number one is resuscitation. Resuscitation যেরকম আগের বার বলেছিলাম, fluids, requisition, admission সবকিছু করলাম। BP বেশি আছে 170/110, you have to go for magnesium sulfate. You know that? বেশি থাকলে ম্যাক্সাল দেবো আমরা। Then you go for delivery. What is the mode of delivery? Cesarean section or normal delivery? Lucius. In abruption, you can attempt vaginal delivery. Always remember, placenta কিন্তু নিচে নেই, placenta উপরে আছে। নিচে কিন্তু presenting party আছে। So we can attempt for vaginal delivery. Shanti, Shanti. 2 more lines. Just 2 more lines. We're going to stop them. Just 2 more lines. In abruptio, we can attempt vaginal delivery if the patient is stable. If the patient is unstable, you go for cesarean section. As simple as that. This patient is unstable, you have to go for cesarean section. Right? Yes. দুটো question answer দিতে পারবে এবার পরীক্ষায়? These are the clinical scenarios that's going to come to you. Exact এটা না আসলো, these are the clinical scenarios that's going to come. One for placenta previa, one for abruptio placentae. কোনটা কিভাবে ম্যানেজ করব? প্লাসেন্টা প্রিভিয়াতেই কনজারভেটিভ ম্যানেজমেন্ট হয়, অ্যাব্রাপশনে কোনো রকম কনজারভেটিভ ম্যানেজমেন্ট হয় না। Once the placenta has started separating, if she is bleeding, you have to deliver, right?